Hello, this is Maria from Can I Consult You, and I'm just going to share my story from the beginning because it's very confusing. And I've been told that nobody's story has followed my path. So here it goes. So in 2009, I had a freckle I had a freckle on the end of my nose. Probably for all my life. I noticed that it was there, and then in 2009, the freckles started to swell. So it didn't change color at all. All it did is start to raise a little bit on the end of my nose. The reason why I went in and had it checked is or biopsy, they did a shave biopsy, is because when I would take a sip out of a can, the little flip top would catch on it, and I almost sliced it off a couple of times myself. So I went in and had a little shave biopsy done, and this is my first report. Let's see, September 29th of 2009. Clinical data, it says pigmented seborrheic keratosis, R/O actinitic keratosis. The microscopic description, or I'll just go to the diagnosis, right? Let's just go to the diagnosis. The diagnosis is minute portions of superficial skin with focal melanocytic nests suggestive of a superficial portion of an irritated intradermal nevus. That's it. That's my biopsy. That's the results. Doesn't say cancer, doesn't say melanoma, doesn't say anything like that. So she says, oh, it's just a normal mole. No problem. So that was 2009. 2012, August 21st of 2012, the spot started to come back. It started to swell up. So 3 years later, the spot starts to grow again. Doesn't change in color, just starts to swell up. So that time, the date, 8/21/12. I thought I was showing you the wrong one. It's not 21, it's 12. 2012, I have my second biopsy. And I'm just gonna go to the diagnosis, right? The diagnosis, intradermal nevus. That's my second biopsy. So then, that's in 2012. So March of 2013, it comes back right away. This time, it comes back, and because it comes back so quickly, they do another biopsy, and here's the results of this biopsy that was done on March 15th, 2013. So I'm going to read you the diagnosis. It says, the differential diagnosis in this case rests between a recurrent compound congenital nevus and a nevoid melanoma. Although there is only minimal cytologic atypia, the fact that this lesion has reoccurred twice and shows rare dermal mitotic figures is worrisome. For the possibility of a nevoid melanoma, I recommend re-excision of the lesion for further histological review and to ensure its complete removal. So looking back at all of my biopsies, and discussing where I should have went with that diagnosis. With my dermapathologist that has been treating me all along. I should have went to a Mohs surgeon. A Mohs surgeon would have removed the mole in different layers, making sure they got the whole entire thing. But a Mohs surgeon would not see me because I did not test positive for cancer. So I couldn't go into a Mohs surgeon. So I went to U of M, first of all, because that's where my dermatologist sent me for my consultation for my supposed, suspected, possible, oh my gosh, maybe melanoma. I went to that consultation at U of M, and I seen Dr. Carol Bradford, something, I don't know. This woman went through all of these details, how she's going to remove my nose, and from 3/4 of it, the whole entire, 3/4 of it, I say the whole thing. And she goes through all these details. And then she says, for what's possibly melanoma. And I was like, wait, what? You're going to remove 3/4 of my nose for what's possibly melanoma? No fucking way. So I go for a second opinion to Karmanos, because why would I not go to Karmanos Cancer Institute? They're right here in Detroit, much closer to me, and it's the Cancer Institute. They surely know more than U of M. I mean, come on. So I go for a consultation with Dr. George Yu, and he explains that there's no need to check my lymph nodes. U of M wanted to check my lymph nodes, and Dr. Yu said there's no need to check my lymph nodes. We're not even sure it's melanoma. So I'm like, thank God, because that was stressing me out to think that, not only a skin graft, but geez, I got to have my neck carved into. So he reassured me we did not need to check my lymph nodes, all up until about 2 days before my surgery. And then he calls to let me know that him and his board sat down and they decided that they needed to check my lymph nodes to make sure that my lesion did not spread beyond my nose. So that's the first time that I had ever been diagnosed with cancer or melanoma or anything. Now, when somebody gives you a diagnosis like that, I can tell you, the world falls out under your feet, and you go into a state of panic like you have never experienced before, and you don't think straight. You rely on them to have your best interest in mind. So I pulled up my bootstraps and I says, okay, what can I do? What can I do? So I went into surgery on May 30th, and I had a skin graft done. And before they did that, they shot some blue dye into the tip of my nose. The dye split and went to the first set of lymph nodes where something may spread. And that's how they decide what lymph nodes they're going to take out. So they took out lymph nodes here and here. And they also took lymph nodes out right here. 3 areas. Not quite sure. But anyhow, 3 areas. And he left me behind 5 titanium clips that I can see on imaging. I didn't know that he was leaving 5 titanium clips behind. He did not let me know that this was part of my procedure. He did not let me know that this is standard medical procedure. He did not do any kind of allergy testing on me to see if I was sensitive or would react to the titanium clips or any other of the metals that may compromise or make up the titanium clips, because it's not always just titanium. Sometimes there's cobalt. Sometimes there's nickel. Sometimes there's aluminum. There's a lot of different kinds of metals that can go into surgical devices that were not tested for before they feel the need to implant us. So apparently they don't always suture and they don't cauterize. They use clips, metal clips, to close off blood supply when they are performing surgery on us. I didn't know about the clips until 2017. So my surgery was in 2013. I found the clips in 2017 through imaging because I blew out my neck because I have constant inflammation. So back to my surgery. I went in, my lymph nodes came back clear. I mean, it didn't test positive for melanoma in the first place. What else would spread? It didn't test positive for any kind of cancer. What spreads that's not cancer? So looking back, I should have insisted that nobody go into my fucking neck. Not Karmanos, Detroit Cancer Institute, not Dr. George Yu, the Chief Medical Executive Director, who specializes in placing adjuvants in the head and neck for cancers. So anyhow, I have the surgery in 2013. And then I go back for my post-op visits, and I have pain here. And, you know, of course, why would I not have pain there? They dug into my neck. And the pain's lasting a lot longer than what I think it should be. And Dr. Yu says, just keep massaging the area. It's probably just scar tissue. Just keep rubbing it. Just keep massaging the area to help break down scar tissue. So I did that with a kinesiologist who is a chiropractor kinesiologist. I had him working on my neck, in my jaw, in my back, and I started seeing a massage therapist weekly because of the pain and inflammation in my neck and in my jaw and my sinuses. And I started getting so much inflammation in my eustachian tubes that my balance would be off. And when your balance is off, you feel very unstable. So that would put me in a position to have massive anxiety when I would drive. And so I don't drive most of the time because I have massive inflammation in my neck and my balance is not always on top of, I just don't feel very stable. So he says just keep massaging the area. So keep massaging, keep rubbing it, keep paying the chiropractor, keep paying the massage therapist, because I need continual care here to keep this inflammation down, because if not, the swelling gets so bad that I blow out my neck. The stress and everything. So anyhow, he says, doesn't ever tell me about the clips. He doesn't tell me about the clips that he placed in my neck. Doesn't say that possibly my pain or inflammation is coming from titanium clips that he placed in my neck without consent. Doesn't say anything about that. So that's 2013. Here comes 2016. I start to get a little spot that grows on the edge of my skin graft. What the fuck is this, right? How could I get a new spot? He did a skin graft. He checked my fucking lymph nodes to make sure that my cancer did not spread. I went to Karmanos Cancer Institute in Detroit. They didn't get it all. They don't know what they're doing. So I decide to go back to the plastic surgeon that closed me up because Dr. Yu worked with Dr. Zuliani, and Dr. Zuliani is a plastic surgeon that was brought in to do the skin graft and close me up, make it look pretty. So I decide, why not go to Dr. Zuliani? Let him do my next biopsy, because I'm going to make sure he goes wide and deep. I request a punch biopsy to make sure we are going to get the very bottom of this lesion and surrounding tissue. So I go to Zuliani, and he does a punch biopsy. 12/12/2016. And the microscopic description is, the sections show skin with intradermal melanocytic proliferation that extends to peripheral margins. There is diffuse, mild cytologic atypia, unusual for an intradermal nevus. Conservative re-excision is recommended. So I give this to my to my dermatologist, and I tell her, I go, look, I had this done. My spot's back. You know, I'm freaking out. You say it was almost melanoma, and is it or is it not? And it's back, and so I'm sure I'm dying. So she says, well, you got to send it back to this other pathologist, because they know to do the further staining, because you have a melanoma history. So they're wrong. We have to send it to this other place. Okay, let's send it to the other place. Let's go. So now the biopsy that was taken off of my nose in December of 2016 on the 12th, now it's going to the new place January 13th. And here's my diagnosis. Irritated intradermal nevus. I'm going to read. There's some cytologic atypia in terms of smudgy hyperchromatopsia and pleomorphism of lesional nuclei. However, now this is highlighted. Highlighted, he did this before I even got it. However, these are favored to represent degenerative changes and not neoplastic atypia. Nevertheless, continued clinical follow-ups is recommended with the removal of any residual or recurrent clinical lesion. This case has been reviewed in consensus with Dr. David Merrigan and two others. 3 people came to the conclusion that orderly nests, cords, and strands of melanocytes are present within the dermis, including some multi-nucleated forms. The melanocytes display smudgy, hyperchromic, and somewhat pleomorphic nuclei. No mitotic activity is appreciated after initial evaluations of these H&E features. A panel of immunohistochemical stains is performed to further characterize the lesional cells, showing them to be uniformly positive for melon A and appropriately stratified by HMB45. Ki67 marks only a rare lesional nucleus. Multiple levels are examined. This is on my website as well. It's not melanoma. They went above and beyond to prove that my new lesion in 2016 after my 2013 surgery is not melanoma. 2017 is when I blow out my neck. And that is when I see the imaging of the clips in my neck. And I lost my shit. I did. Why would I have fucking metal in my neck? So I make an appointment and I go back and see Dr. Yu and I ask him, what is this? And how are we going to get them out? And he says, well, we're not going to get them out. He says, they don't come out. He says that metal doesn't cause any issues in the body. I tell him that I'm constantly red here and here. My chest gets red and inflamed. I have pain. I says, I can feel them. I think I can feel them. I literally can touch them, and you can't touch my fucking face. I have been being treated by a kinesiologist because of my neck, because of my jaw pain and my low back blowing out constantly. I go to the massage therapist weekly because of all of this congestion. And if I'm not massaged, I can't drive. Like, I figured out how I can drive my massages. It gets my congestion down. So I says, no, these clips gotta go. And he says, no, I'm not removing them. There's too much scar tissue. He says, I'll probably cause paralysis, facial paralysis, and I'm not taking them out. Really? So I'm stuck with them. Okay. I mean, what can I do, right? The original surgeon won't remove them, and I must be crazy because there must not be anything wrong with me at all. So 2018 comes along. I go back and see him. He says I had an autoimmune condition and the metal isn't causing me any issues, and no, he's not taking them out. So something stresses me out at that point so bad that my fucking lesion grows back. This is 2018. This is June 26th, 2018. I had another biopsy done. Why? Because it started growing back again. Let me tell you what the diagnosis is. It's on my website too. Superficial aspect of irritated intradermal nevus. If clinical lesion persists despite treatment, a repeat biopsy is recommended. That's 2018. 2019. October 29th, 2019. Guess what? My lesion comes back. The diagnosis, superficial aspect of intradermal nevus. That's 2019. 2020, it comes back again. So that was October of 2019. This is 6 months later, 7 months later, March 2020. Now, we decide to take 2 samples because not only do I have a flat brown spot, but I also have a raised non-colored spot, because when it would come back, it wasn't always coming back the same thing. Sometimes it would come back a flat colored freckle, and sometimes it would come back a raised non-colored little bump. So in 2020, it comes back not only a flat, dark bump, but also a raised, non-colored lesion. So now we have specimen A as well as specimen B. So specimen A comes back intradermal nevus and scar. Specimen B comes back atypical compound melanocytic proliferation extending to lateral and deep margins. So the diagnosis is, now they're saying, so on specimen A, atypical compound melanocytic proliferation extending to the lateral and deep margins. Comment, the findings are concerning for a nevoid melanoma. The lesion extends to a depth of at least 0.9 millimeters. This part will be sent further for evaluation. This is going for genetic testing because now they're not sure, right? I mean, I've had like fucking 9 biopsies. Now they're not sure. So my first genetic test, let me get to it. Right here. It's a fish analysis. See? Fish analysis. So the results are negative. A positive would put me over 29%. All of my results came in between 4 and 6%. I'm nowhere near positive for a genetic test for melanoma. So there's that. So then the dermapathologist says, well, possibly he didn't get clear margins when he did your skin graft. So he requests my skin graft, and it was removed May 30th of 2013. Dr. Merrigan took another look at it on March 18th of 2022. And guess what? All the edges were clear and free of margins. In the diagnosis, atypical compound melanocytic proliferation. The lateral and deep margins appear free of involvement in these sections. So does that mean that my lesion that Dr. Georgiou removed was not melanoma? Is that what it means? So now they want me to U of M. I go back to U of M for another opinion because, something's happening. And that surgeon insists on having more testing and stuff because he's like, wait a minute, why am I even seeing you? You don't even have a positive diagnosis. I'm like, I know. How silly is that? So he insists on some more details. And I insist on a brain MRI and a PET scan because I'm like, okay, so you're saying now in 2021 that this is melanoma, or 2020, this is melanoma. This has been melanoma. This has been melanoma that we were trying to avoid in 2013 that did not come back, didn't spread then, still hasn't spread. I mean, we don't know if it's spread or not. They want me to have 4 surgeries to reconstruct my face without making sure that it's not in my brain, right? So I get a brain MRI. It's negative. There's nothing in my brain at all. I also have a PET scan. All of my stuff is on my website. If you want to read it and look and dive in and maybe help give me your opinion as well. So I have the brain MRI done and I have the PET scan done. And in the PET scan, my nose doesn't light up in the PET scan. I had like a hair follicle maybe light up over here. They said, oh, it's probably just a hair follicle. Bright yellow. I'm like, that's crazy. What is that? Is that cancer? No, that's just an infected hair follicle. Why is my nose not lighting up? My nose is melanoma since 2009. Why would that not light up? Well, skin cancer doesn't really always light up. Is it skin cancer or is it just a lesion? Is it scar tissue? What is it exactly? So then they say, oh my God, you have an 8mm mass in your right parotid gland. That's metastasis from your nose. You're fucking dying. Really? Am I? So now they want, okay. So then I decide, okay, I'm going to go back to Karmanos. Because Dr. Yu's going to be pretty pissed off at his skills. They misdiagnosed me. They didn't get all of my lesion. It came back. It's going to hurt their status, their statistics of clearing cancer. So I go back to him and he wants to do a needle biopsy on my 8mm mass because he's sure that that's metastasis. And if it is, not only is he going to do the forehead flap surgery that U of M suggested with 4 surgeries, but he's going to add another surgery to that. And he's going to do a 5th surgery. And that surgery is going to remove my right parotid gland as well as all surrounding jaw bone and any bone that's around it to make sure that I'm not going to have melanoma take me out. Then he's going to remove this ear because he needs the ear bowl to reconstruct both of my nostrils because he's definitely taking all of this off now because he's going to make sure that this does not come back ever. And then he's going to do a forehead flap and he's going to fucking curve me up, flip this over, attach it here until it takes hold and then cut this off and cut this off. It's like 4 surgeries. They say, some say it's a 2-year process. Some say you can get it done in 6 months. But here's the thing. I didn't test positive for melanoma ever. And I still continue to not test positive for melanoma. I've had 3 genetic tests done. The first one is so fucking negative, it's not even funny. The second one, let me show you my second one, actually. It's quite hysterical. Malignant for melanoma. So let me show you why I'm malignant. See the score? 0.1. 0 is negative. 1 is positive. I'm 0.1. I'm 9/10 negative and 1/10 positive. I'm not buying it. Would you move forward with 5 surgeries to your face on 9/10 negative and 1/10 positive? I ain't doing it. So that was my second genetic test. My third genetic test came back with some mutations, genetic mutations. And luckily, I started training under Dr. Wallach, Dr. Joel Wallach, and he teaches about epigenetics and gene mutations. And I'm not having 5 surgeries to my face because I ate like shit. And it created my genes to mutate. So I'm working on my gene mutations. I know that I can reverse those gene mutations with nutritional supplementation. So I'm not having 5 surgeries to my face for that either. So what I have discovered is that our immune systems can mimic a pathway that is more well established. And there is documentation that was released in 2019 from our FDA that states so many reasons why my lesion continues to come back. And it's not melanoma, and it is because these titanium clips have created an autoimmune response. So there is an autoimmune condition, and it's called Asia. It is autoimmune response syndrome, autoimmune syndrome induced by adjuvants. Adjuvants, what Dr. George Yu specializes in placing in the head and neck for cancer. So that's my autoimmune condition that Dr. Yu said that I should probably go be diagnosed with. It's called Asia, and it's brought on by adjuvants placed within the body. I'm reacting to the metal that's in me. My girlfriend just had 130 pieces of metal removed from her abdomen, and they were rusted. They were rusted in her. My other friend had about 28 clips removed from her neck. And when they removed those, she also removed multiple symptoms that she was dealing with. She literally went in a wheelchair and walked out because she lessened her load. So anyhow, I just want to share my story and how I got here. And hopefully it explains a little bit better to those that are confused. I don't have melanoma. I never had melanoma. I refuse to be treated for melanoma. I am having an allergic reaction or an autoimmune response to the titanium clips that were placed in my neck without consent by Dr. George Yu, who is the Chief Medical Executive Director of Karmanos Cancer Institute in Detroit, Michigan. I asked him to address my clips. He will not address my clips. I actually got 2 letters from Karmanos stating that they will not address this situation for me at all anymore. Do not contact them to talk about my clips or my allergic reaction to the clips. They say if I want to treat my melanoma, they'll definitely treat my melanoma for hundreds of thousands and thousands of dollars. Yet they won't address my allergic reaction to the titanium clips that Dr. Yu placed inside of me without consent. And nobody else will either. Like, there's surgeons I have contacted, so many, and nobody will touch me, not with a 10-foot pole. And so what I found to do to address or manage my allergic response or immune response is I put 3 modalities together. One of them in my I don't know which one is more important. Honestly, I think they're all running for competition. So I start every day with 32 ounces of celery juice, straight celery juice, no added water, on an empty stomach. I juice it and I drink it down within 20 minutes. And celery juice has sodium cluster salts in it that come in to my bloodstream, and they neutralize the metal. And they neutralize the toxins coming off of that metal. And it brings my viral load down from those toxins, and it brings my inflammation down, and it brings my swelling down, and it brings my reaction down, and it keeps me from blowing out my back. I confirmed that 1,000,000% because I started drinking celery juice December 22nd of 2020. I had blown my back, I want to call it my back blowout. In June of 2020, I came back to work after being off of work for 3 months because we shut down for the pandemic. And I came back to work and I worked for 10 days and I blew out my back. That back blowout did not allow me to stand up. It did not allow me to take care of myself physically at all. I could not shower by myself. I could not change my clothes by myself. There was a couple times where I actually did get back to thinking I could cut hair. And I did a couple haircuts and bam, right back down. I went right back down and right back from square one. It was debilitating. I went through major testing. I thought that I needed to have surgery to fix my back finally. They told me that I had something wrong with my arteries from my kidneys, dysplasia or fibrous dysplasia. I don't know. But whatever that indicated, it indicated that I probably had the same issue with my carotid arteries. So then I had the wrong technician do my test. It was a mess. I literally thought I was dying. I thought my kidney arteries were blocked. I thought my carotids were only open like 30% from the test results. It was insane. So my mental status just took a shit. It really went down. I was used to working. I worked for 30 years, about 6 days, 5 days, 6 days a week, 10, 12, 14 hours sometimes. I was used to working in between back blowouts, and then I couldn't even take care of myself, and everybody else got to go back to work except for me. So June 2020, I blew out my back. December 22nd of 2020 is my first drink of celery juice. I was already on cannabis oil, and I was taking supplements, random supplements, and then I started drinking celery juice every day on an empty stomach first thing in the morning because my daughter Carla had said, "You've got to do this," and my mental state had taken such a shit. I was drinking. I couldn't stop drinking. I had my weekend cocktails, my nightly cocktails just progressed more and more and more because I couldn't go to work. I couldn't stand up. I was laying down so much in bed that both my lungs bilaterally collapsed. So the imaging that I had done that exposed what was wrong with my kidney, my renal arteries, it exposed that both of my lungs were bilaterally collapsed because I laid in bed so much and slept because I could not sit up, I could not stand up, and I could not work or function. So yes, I was drinking every day. It allowed me to sit at the kitchen counter a little bit longer and somewhat talk to my family after they got home from work. So December 22nd, I drank my first 4 ounces of celery juice, and it allowed me to not make my Cosmo that morning, and I drank it again December 23rd, and I continued to drink it every single day. Up until just recently. So I worked my way up to 32 ounces, and that's where I stay. And I found out that when I play around with it and I don't drink it, my inflammation comes up, and I do not do well at all. So I've never went this long without drinking celery juice until just recently, because I had to have my metal test done to prove that I'm reacting to the metal inside of me. So the test said to not take any antihistamines. So I stopped drinking my celery juice because it's my massive antihistamine. I didn't drink it for 10 days. On day 11, I drank my juice. On day 12, I drank my juice and I blew out my back. Day 12, day 13, day 14, it's a series of electrical shocks that then tighten me down into a very twisted spasm, and I can't use my arms. I can't hold them up. I can't stand up for very long. I'm twisted. My butt sticks out, and my pelvis is cocked back. It's not good. Takes a while. It's going to take me a while to unwind. So that's what the celery juice does for me. Hopefully it's not going to take me months to get back to where I was, because I was strong. I mean, I was ready for a landscaping business. I was so strong. So I do celery juice, 32 ounces every single morning, and I'm doing it again. And I'm never taking another metal test again. I'm not stopping it again. I don't want to be here with my back. There's only so much a mind can handle. So then I also found that I have to ingest 1,200 milligrams of THC dominant oil every 24 hours, or my inflammation comes up. Why? Because cannabis oil is 40 times more effective than a steroid. So that's my steroids that I live on, my cannabis oil, 1,200 milligrams a day. You titrate up, you get used to it. It doesn't affect you once you titrate up. And I produce the oil myself. I teach others how to produce their own oil, because nobody can be trusted when it comes to your own medicine. And I teach people how to produce oil, infuse oil, and then ingest the oil. I am a Canation trainer. I am a Canation is a coach or a counselor that's educated and knowledgeable not only how to use medicine or cannabis as medicine, but they can apply that knowledge to others and help guide patients to use cannabis as medicine. So I'm a Canation trainer, and train other Canations to use cannabis as medicine as well. And then I also do 90 essential nutrients and vitamins every single day. So if we are not taking in the proper amount of vitamins and nutrients and essential fatty acids every day, our system does not work like a well-oiled machine. And I didn't know that if we're lacking the minerals, the plant-derived minerals that we need so desperately bad, if we're lacking those, we can't carry out the heavy metals in our body, or the excessive heavy metals in our body. So there's that as well. I didn't know. I mean, and we don't know what we don't know, right? So I use minerals to help facilitate carrying the metals out. I use lots of sea vegetables, and I've incorporated a lot of things into my diet. Cilantro gets heavy metals out. I eat cilantro in every single salad. I eat a salad every single day. Why? Because that's how I thrive. So this is my story. The whole entire thing. I don't know if I've left anything out. I'm trying to manage my reaction until I can convince a surgeon that I am reacting and I need these clips out. And once I get them out, I'm going to do everything I can to change the standard medical procedure and make sure that we are all informed patients. There's a lot of us. There's 2 groups on Facebook right now, and there may be more. There's only 2 that I know of that I'm in that we can go to when we are thinking that we have a reaction to the clips or the metal that was placed inside of us, or our implants, or possibly implants that we don't even know of. So there are groups. Please reach out if you think that you might be having issues at all. Reach out. I'm on a mission to get everyone's email address because I want to have a Zoom. I want to bring us together. I want to show how many faces are affected. We need to stand together and help each other, because there's some of us that have died because of these reactions. I mean, my friend that had the 130 removed, she's got melanoma. She had melanoma inside of her. They were attached, her tumors were attached to her clips. And the surgeon went in and removed the tumors, but they still left the clips. She had to travel and pay cash to have her clips removed. And she also has lymphoma because of her reaction to her clips. I think it's lymphoma. She has some other blood cancer that she's dealing with because of her clips. I mean, for fuck's sakes, why would the surgeons not listen to us? Why would they not listen to us? They have to listen to us, especially when they are the chief medical executor of a cancer institute. For Christ's sakes, you need to hear us. So I'm Maria with Can I Consult You? I'm very emotional. You can reach me on my website. You can reach me directly through Facebook, Instagram, TikTok. Call me, 586-484-4378. Reach out and connect, or just listen to my story. That's it. Thanks.